Welcome to our webinar event for the Masters in Nursing with the Indiana University Regional Consortium. I am Jennifer Teeter, and I'm the Graduate Nursing Director at Indiana University Southeast. I'd like to share a little bit of information about the IU MSN Regional Consortium. So our consortium is made up of the following campuses: Indiana University East, Kokomo, Northwest, South Bend, and Southeast. We are offering this session to give you more information about our programs, the tracks that we offer, and how the consortium will work, and as well as information about the cost of applications and requirements. We have speakers from the different campuses on during the webinar, and then we'll also have time for a question and answer session. So if you have any questions, please put them in the chat, and we'll respond to the submissions at the end. A consortium basically means that we are working together to share curriculum, courses, and resources to ensure students have the richest experiences in their MSN program at IU. The regional campuses have decided to form this consortium to allow students to have more flexibility in their programs while staying in their own community for a graduate education. So the consortium will allow students to take mainly online classes with the ability to connect with their faculty and their peers with synchronous Zoom sessions each semester while allowing students to stay in their community for clinical. So students will have the cohort feel while getting to interact with other IU students and full-time faculty and staff from across the state of Indiana. Students will be applying to their local campus and be admitted there, and then they'll sign up for courses on their campus. So you'll also interact with faculty from campuses for lab, clinical, and practicum experiences. You'll hear more about the specifics from our speakers who will discuss each track, but here are some of the highlights. In addition to the new consortium structure, our curriculum has been recently revised to align with the latest AACN essential standards and the shift towards competency-based education. Students will complete coursework in key areas such as population health, quality improvement, and safety and informatics. Foundational content and advanced physical assessment, pharmacology, and pathophysiology is also included, along with a robust clinical preparation for national certification and advanced practice roles. I'm now going to turn it over to my colleague, Paula Baumann, who will provide you more information about our programs.
So my name is Paula Baumann, and I am the Associate Dean for Graduate Programs at Indiana University East. And all of our Masters in Nursing programs are nationally accredited by either ACEN or CCNE, and we have been offering graduate programs at our campuses for over 10 years, starting in 2012. All of the consortium campuses are going to be offering the MSN degrees in nursing administration and nursing education, and the family nurse practitioner track will be offered at East, Kokomo, Northwest, and South Bend. I will do a brief overview of the MSN programs, and then we will have other faculty go into more depth about the different tracks. The administration and education tracks can be completed in 6 semesters or 2 years, and the FNP track can be completed in 7 semesters with a January start and then a May graduation. The core and track classes are offered in an online format with scheduled synchronous Zoom sessions, which means you join online using Zoom up to 4 times during each semester on a predetermined date. The rest is done online using our Canvas learning management system. Our synchronous Zoom meetings are always on Thursday from 10 a.m. to 12 p.m. Eastern Standard Time, and usually they happen around the beginning of the semester, one time each of the next 2 months, and then toward the end of the semester. Students will have all of the synchronous Zoom dates when they're admitted into the program. The health assessment lab will require you to come to campus for practice and checkoffs on 4 set dates, and students will attend the clinical, they will also attend clinical or practicum courses in person as well. So although you won't be on your home campus a lot, you will have the opportunity to be on the campus some. Students usually take 2 classes each semester for a total of 6 to 8 credits. I will now turn it over to our administration, education, and family nurse practitioner faculty to provide additional information about each program track.
My name is Mary Burke, and I'm a professor of nursing at Indiana University Kokomo, and I will provide you with a short information session about nursing administration and nursing education tracks. The nursing administration track, you may be wondering, what will I learn? What skills? The nursing administration curriculum focuses on building a solid foundation in leadership, including managing employees to achieve healthcare goals, understanding hospital finances, such as revenues and costs, and practicing principles related to quality and safety of healthcare systems. Additionally, it is crucial to understand the legalities of care delivery and other business-related aspects. So each course builds your knowledge and skills to prepare you ultimately for the practicum at the end. At the end, like I said, of your program, faculty will design specifically for you a 3-credit-hour practicum experience that provides real-world experience within healthcare organizations for an aspiring nurse leader or someone already working in an administrative role who wants advanced knowledge and skills. Through this direct practicum experience, students gain a deep understanding of the intricate dynamics of healthcare leadership and management through a partnership with an organization. For example, a preceptor from a healthcare organization working with an MSN student on an evidence-based practice project to evaluate a nursing practice, a policy, or procedure based on current evidence. Through this partnership, students can observe and actively engage in real-world scenarios, honing critical skills in decision-making, problem-solving, and strategic planning within healthcare settings. For nursing education track, this is a hybrid program, which really means 2 of the 11 courses will be taught in person at your home campus. The in-person courses are T670 Teaching and Nursing and T615 Nursing Curriculum. These 2 courses will offer numerous in-person experiential experiences to enhance your knowledge and skills as an educator. So why is this degree essential to an educator? It's because you will learn to design and create engaging materials for various instructional settings, including didactic, clinical, occupational health, and hospital-focused settings. Your instructor will help you focus on the instructional skills relevant to your intended career goal. The 2 in-person courses provide an environment where the instructor can facilitate your learning of instructional technologies, including instructional gaming, graphic design, leveraging artificial intelligence for instruction, learning management systems, and animation embedded instruction, among multiple other skills. Faculty will focus on your skill level and the pace at which you learn best. So do not fear the instructional technology. So like nursing administration, faculty will design, the nurse education faculty, they will design specifically for you a 3-credit-hour practicum experience that provides the real-world experience to practice this new advanced knowledge and skills within a healthcare, academic health, or healthcare-focused organization. For your practicum, we will arrange an MSN prepared preceptor for you to work with specific for your career goals. So for those with an academic focus, you will be assigned to a university or college faculty to experience teaching didactic and clinical courses. Suppose you want to be a hospital educator. In that case, you will work with an MSN prepared hospital preceptor to experience how to enhance the knowledge, skills, and performance of healthcare staff within a hospital setting. For those interested in becoming an occupational health educator, you will learn how to teach others to care for, prevent, and respond effectively to occupational health challenges. Your practicum faculty will collaborate with your assigned preceptor to help you prepare, design, and develop instruction appropriate for your practicum experience. So upon completing these practicum experience, you will possess the knowledge and skills necessary to be workforce ready as a nurse educator. So what makes our program different from many other options available out there? We prepare you to practice in the real world. We offer much more than reading a chapter in a textbook and taking a test. The context in which we designed our program is the environment in which you will practice after earning your Master of Science in Nursing. Our goal is to ensure our students are well prepared for their future roles. It's that important to us. Next, Caitlin will talk about the Family Nurse Practitioner Program.
Hi there, my name is Caitlin Volemic. I'm the MSN Program Director and Clinical Associate Professor at IU South Bend. I'm also a family nurse practitioner, and I graduated from our program here at IU South Bend. Amid the ever-changing U.S. healthcare landscape, nurse practitioners have become the healthcare provider of choice for millions of Americans. Nurse practitioners diagnose, treat, and help prevent common and acute illnesses and manage chronic diseases. Health promotion and disease prevention are also a primary focus. Nurse practitioners are advanced practice registered nurses with specialized training. There are many nurse practitioner specialties one can choose from. However, family nurse practitioners have the broadest focus and care for a wide variety of patients of all ages across the lifespan, including infants, adolescents, adults, and the elderly. Family nurse practitioners work in various healthcare environments, such as hospitals, primary care offices, outpatient facilities, urgent care clinics, private practice, community health centers, and long-term care facilities. Our family nurse practitioner track includes core classes in quality and safety, informatics, population health, leadership, and the 3 Ps: advanced pathophysiology, advanced pharmacology, and advanced health assessment across the lifespan. Our primary care courses are designed to allow students to take advantage of caring for any type of patient visit while in the outpatient clinical setting. If you enjoy working with diverse populations, making a difference in your community, and are skilled at empowering patients to maintain their health throughout the lifespan, then a career as a family nurse practitioner may be the right choice for you. Throughout the 4 primary care courses, you'll complete 750 clinical hours. The first 2 primary care courses have 150 hours minimum required, which is usually 1 day a week of clinical across the semester. The 3rd and 4th primary care courses have 225 hours minimum required. This is about 2 days a week in the clinic. Because we do not have separate pediatrics and women's health classes, a set number of hours will be required in pediatrics, women's health, and geriatrics. We are partners in the clinical placement process. Obtaining clinical placements has become more challenging. This is especially true for pediatric and women's health hours. There are many family nurse practitioner students who are seeking clinical sites, which has made clinical placements competitive. As a result, many healthcare systems will only provide clinical placements for their own employees who are seeking advanced degrees. Most health systems, though, have a process in place to apply for clinical placement. Most will not allow clinical placements to be arranged solely by the student and the preceptor without going through a campus representative for approval. Our program directors help confirm all placements for students and will work with you to obtain the best clinical experiences for you. Now, Stephanie Branco Lincoln from IU Northwest will discuss the application and admission process.
Thank you, Caitlin. My name is Stephanie Branco Lincoln. I am faculty on the IUN campus, both in the undergraduate and the MSN program. Today, I wanted to talk to you about the application and the admission process. The best place to really start for information about the admission requirements is on our official websites. After this webinar, I encourage you to check that site for more information about admission requirements, application deadlines, the curriculum for the program, And you can also use the link provided on that page to begin your application process. So how do you apply? You begin with your application using the links. Make sure you keep the specific dates in mind to be aware of when completing the application, because it can take some time. Here are some important deadlines to keep in mind. If you're applying for the FNP track, the application opens up on April 1st, and the deadline for the application closes on September 15th. Applicants are then notified in October for a program start in January, which is the spring semester. For the education track, this is open all year. Applications are accepted up until 2 weeks prior to the start of the semester, and this is what we call a rolling admission. Students are notified on a rolling basis based on when they apply and the next start date. Please note that there are start dates for both August, which is typically fall, January, which is spring, and May for summer session. This same application is also applicable to the administration track, meaning that it is open all year. We'll accept students up to 2 weeks prior to the start of the semester. And again, it is a rolling admission with notification. So what are the application requirements? The items that you will need to submit or complete as part of the application process are as follows. All non-IU transcripts need to be submitted. We can collect any transcripts from IU on your behalf. You'll need to submit an updated CV or resume. You'll need to include a personal statement, a little bit about yourself. You'll need 2 professional references, a background check, and lastly, a drug screen. You need to have earned your BSN and also have an unrestricted license that is valid in the state of Indiana, and this is just because of the practicum requirements. However, if students have just completed their BSN, we also encourage them to apply. Some of our programs, for example, the education and administration track, we prefer 1 year experience, but 2 years is preferred. However, if you're starting after you've completed your BSN track, you'll meet that education requirements as you begin your practicum hours. For the FNP track, again, we prefer 2 years experience, or at least have completed it by the time you take your assessment courses for the FNP track. Once you begin to submit materials, each campus has a designated person whose role is to stay in touch with you and to work with you on your application and help you navigate the process and any questions that may come up along the way. Now is the biggest question. What's the estimated cost? Aside from questions about the application, the most common question I often hear is, what is the cost of your program? We've provided here an estimation of what typical programs will cost students. If you're in the MSN FNP track, graduate tuition for in-state students on average is about $457.19. Please know these are only estimates, and the fee schedule can actually be found on the IU Bursar website. So the approximate cost for an in-state student to complete the FNP track is around $20,000. For graduate nursing tuition for Indiana partners, and these are participants or students that live in Kansas, Minnesota, Missouri, Kentucky, Ohio, Wisconsin, they have a discounted rate, and that rate is around $685 a credit hour, or approximate cost of about $30,000. Students that apply outside of these 2 areas are applicable to out-of-state tuition, which is $1,329, or about $60,000 to complete the program. Our MSN education and admin track is a little bit less just because of curriculum and CE hours that are needed, credit hours that are needed. For in-state tuition, the total program cost is around $17,000. For our Indiana partners, for these tracks. The approximate cost is about $25,000. And then for people outside of these two areas, the total program cost is around $50,000. Again, these are only estimates to get the most current and up-to-date fee schedule that can be found on our IU website. There's also a tool there that can help you calculate the total costs. One thing to note, the textbooks can be very expensive, and that's really difficult to provide you with an estimate for that. So please note that textbook fees are in addition to the approximate cost we've provided. Textbooks can be available in various formats, from book to digital, and you can even rent or buy them. Please know that help is available. We do have some scholarship opportunities, and we will assist with finding preceptors in the clinical placements at no additional cost to you. We encourage all students to apply for financial aid with the FAFSA. The experts in our financial aid office can answer any questions about that application process. Be sure to tell them that you are a graduate student applying for the MSN program because aid is available and it is a little bit different for the graduate students. Our advisors can also help assist with any scholarships that are available on the local campuses.
So now we'll look at some incoming questions that we might have in our chat room. And now is the opportunity for you to ask questions. So the first question is, your campus will provide valuable information and links for financial aid. It is important to fill out the FAFSA application. There are scholarships available specific to your campus, so it is important to contact the financial aid department. So that was more of a comment than a question. But for those of you who are online, do you have additional questions that you might want to ask us about the program? So I have one question. So someone's asking that if they're considering starting the program, but they're not sure yet, do they have the ability to take a class ahead of time? So does somebody want to answer that, or?
We have a graduate non-degree seeking policy. So meaning that the students, if they're wanting to try out courses, they can absolutely apply as a graduate non-degree student in order to take a course. All of the core courses that are offered among the tracks, so all three tracks, they take the same core courses. Any student at any time can take one of those courses when they're offered. So yes, we have a different application process for that as students are interested in taking classes. There is a question in the chat about what type of clinical sites are typically used and how are we placed in those clinical sites. So from the FNP perspective, it depends on the semester that you're in. We have primary care courses based off of illness processes. So for example, your first semester is acute illnesses. So urgent cares could be used for that process. We still use family practice, women's health, pediatrics. And so we as graduate program directors, or some campuses have a clinical coordinating position. You would have those individuals at your campus who would work with you to try to solidify those. Students, if they have interests, so like they know a provider or a clinic or a place that they want to have their rotations in, it's helpful for the faculty or the program directors to know that so that we can help liaison with you and get those placements for you. So that was a great question. And hopefully I answered your question correctly. In regards to the education and administration practicum or clinical sites, I will let either Mary, Jennifer, or anybody else for the admin to answer that question.
Yeah, for nursing education, we focus on what is your intended career when you finish, and that's what we focus on in finding an MSN prepared preceptor. I'll let Paula talk about nursing administration.
So probably a common question that we get is, can I do my practicum where I work? And we will facilitate those nursing administration students to do the practicum where they're employed. We just make sure that we find a preceptor who meets the requirements of a preceptor, which means they have a master's degree, they have experience in their role. And then we ensure that it's something that you are doing above and beyond your current role. So you can't just get clinical hours for your current job, but it would be something that would elevate what you're currently doing at a higher level, and you'd have opportunities to attend meetings and work on projects that you wouldn't do as part of your employment. If you would like to do clinical at a different facility, then we can also facilitate placement with a preceptor there as well. So here's another question. So someone wanted us to expand on how you will support the FNP student with finding a preceptor.
I was hoping I clarified that well enough with my description from the original question. But again, some facilities have application processes, so your campus will inform you of those processes if they're available. Program directors or clinical coordinators as well will know where you can go for certain semesters. But again, if you are unsure of where you're wanting to go, obviously the program directors and clinical coordinators will help with you on that as well. Because yes, we all use Typhon, which is a database where we can put all of our providers in. So we usually will have lists, contact information, and such for students to be assisted.
So I'm going to address the one about speak to the competitiveness of the cost. I think they're asking about cost versus private and public. We are a state-supported institution. Our tuition and fees are significantly, dramatically less than private institutions. And because we're a regional consortium, our costs are very reasonable.
I think one comment I'd like to make, even though we have extremely reasonable costs, as Mary stated, one of the benefits of the consortium is you get the best of all the faculty on all of our campuses. And that's what's really unique. Each campus has many strengths. So you're not limited to the strengths of just the faculty on your one local campus. You have access to faculty on multiple campuses. And that's what really makes this consortium graduate program unique.
And the regional campuses have a different cost than some of the other IU campuses as well. So that makes us competitive. We have another question is, do we take, let's see, the question is, does IU take graduate transfer credit from another MSN program and is statistics required? So we require that they have a undergraduate statistics course, 3 credits completed before they come into our program. But most of our BSN graduates have had that class as part of their curriculum. If they have not, then they can take that as prior to starting the program. And that's where it's really important to talk with the advisor, because a lot of times they can get them in a course prior to the start of the semester so that they can continue on without much delay, or they can be admitted into the FNP program and start in January if they take that over the fall semester. We also had, do we take graduate transfer credits? We can take some graduate transfer credits, but we do have to look at the course and make sure that it meets the requirements of the course that we're going to give credit for. And so that's something that you would also work with the advisor. But if you've started in a program and realized, oh, IU Regionals has a program I'd like to transfer, please reach out because that could be a possibility. And then we had another question, which I'll let someone else answer. If a class is taken in advance in hopes to start the program the semester after, is the applicant pool generally full, allowing for some to be turned away, or is this something not to be concerned with? So although the program is competitive and we do have limited spaces, by you taking a class in advance, it doesn't mean that you would still be considered as an applicant in the pool. And so it would not be a detriment if you took something early. Does anybody else have any comments on that question?
Same. Not that we have that in our evaluation process of applications, but I would assume that graduate committees on each campus may look highly at that candidate if they've been successful in taking a graduate course as a guest. So I know at South Bend that would be something that we would look at, not to take away from any other campus, because that is our job as well, is to not pull from others. We do look at that as well, not to go off on a segue, but if this is a student that is looking to or living or close to a certain campus, we would not try to, we would enforce that student or encourage that student to, consider the campus that they are closest to for those face-to-face meetings that are required.
So we would not deter you from taking a class ahead of time, and that would demonstrate, if you do well, that would demonstrate that you are ready for graduate coursework and could be a positive. Then what qualities do you look for in competitive applicants? That's another question. Jennifer, do you want to take that one?
A good one. Someone who's excited to learn, someone who is enthusiastic about the process, who's eager to expand their knowledge, obviously. Those are all qualities that I'm looking for in potential graduate students.
I can speak from the admin education track in particular. It really requires somebody to be self-motivated and committed. It's a lot of work to go to graduate school. It requires a lot of self-motivation and internal drive. And it can be challenging at times, just balancing school, work, family, and sometimes even sanity. So I think just one of the things that's really important is just somebody that's really committed and has a vision of what they would like to do, and is also self-motivated. I think those are really some key characteristics that help students be successful.
I have found the most successful students prepare their families in advance. Tell the kids you're going to have to participate in fixing meals. Mom is not going to be available some days. So they understand, especially kids if they're in elementary, junior high, or high school, they understand the demands on time. But organizing that beforehand, making sure everybody's on the same page, and a spouse possible, make sure they're supportive of the process. And I can't emphasize enough, get your financial things, FAFSA filled out and financial aid all in order so that it's not a strain on the family also.
So I think we'll be about ready to wrap up, but I will just follow up with, although programs are rigorous and it does take some preparation ahead of time, we also have candidates who continue to work full-time, have families, and are very successful and go on to be certified and do very well. So we don't want you to think that it's not possible, because as nurses, we're used to doing a lot and being resourceful. And so please reach out if you have questions about that. But we do have a lot of students who are able to work full-time and maybe save up some of their PTO time toward the end so they can get their practicums done. but they've been able to maintain a full-time job during the programs.
I will have to say, I've not seen one faculty person that's not dedicated to your achieving your goals, to graduating from the MSN program. So it is by far the best group of faculty you'll ever encounter.
So I would like to thank all of you for attending or watching today's webinar, and a reminder of our contact information is provided on this slide for each campus, as well as a link to our regional webpage. And we look forward to hearing from you and hope you decide to pursue your MSN at a regional IU campus. And we hope you have a great rest of the day. Thank you so much.